Controlled breathing techniques are a powerful and accessible tool for reducing and managing pain because they directly influence the autonomic nervous system and modulate nociceptive signaling in the brain and spinal cord. The nervous system communicates pain through a balance of excitatory and inhibitory pathways, and chronic or heightened pain often corresponds with hyperactivation of sympathetic circuits and overresponsiveness of spinal nociceptors. Controlled breathing, particularly slow, diaphragmatic breathing with extended exhalation, engages the parasympathetic system via the vagus nerve. This reduces heart rate, lowers circulating cortisol levels, and dampens the excitability of neurons in both the spinal cord and pain-processing regions of the brain, including the anterior cingulate cortex, insula, and somatosensory cortex. By actively shifting the autonomic state from sympathetic dominance to parasympathetic balance, controlled breathing can decrease the subjective intensity of pain and improve emotional resilience in response to discomfort. Box breathing and coherent breathing are two common structured techniques that demonstrate measurable effects on pain modulation. In box breathing, an individual inhales for a fixed count, holds the breath, exhales for the same count, and holds again before repeating. This rhythmic pattern stabilizes heart rate variability and synchronizes neural oscillations in areas that regulate attention and emotional processing, which indirectly reduces the amplification of pain signals. Coherent breathing, typically involving slow inhalation and exhalation at a frequency of approximately 5 to 6 breaths per minute, promotes resonance in cardiovascular and respiratory systems, optimizing vagal tone. Improved vagal tone is associated with enhanced inhibitory control over nociceptive circuits, allowing the nervous system to filter out unnecessary or exaggerated pain signaling. The mechanisms by which controlled breathing reduces pain extend to both peripheral and central processes. At the peripheral level, parasympathetic activation constricts the overactive sympathetic vasculature, reducing local inflammation and edema, which are common contributors to nociceptor activation. At the central level, controlled breathing modulates the release of neurochemicals such as gamma-aminobutyric acid, GABA, and endogenous opioids, which inhibit pain transmission in the spinal cord and reduce excitatory signaling in higher brain regions. Functional neuroimaging studies have demonstrated that slow, intentional breathing decreases activity in the insula and anterior cingulate cortex, two regions critical for the emotional and evaluative aspects of pain perception, effectively reducing the affective component of pain even if nociceptive input remains constant. Controlled breathing is also effective because it interacts with attention and cognitive appraisal, two key modulators of pain perception. Pain signals are amplified when attention is hyper-focused on the sensation or when individuals anticipate discomfort with anxiety or stress. Deliberate breathing shifts attentional resources to interoceptive awareness of the breath rather than the pain itself, reducing the top-down amplification of nociceptive signals. Over time, regular practice strengthens prefrontal inhibitory circuits, enhancing cognitive control over pain perception and improving coping strategies. Furthermore, controlled breathing is versatile and can be applied in both acute and chronic pain contexts. Short bouts of slow, structured breathing can reduce immediate pain intensity during acute injury or post-procedural discomfort, while long-term practice supports neuroplasticity in pain-modulating circuits, improving tolerance to chronic pain conditions. It is non-invasive, requires no equipment, and can be combined with other interventions such as mindfulness, physical therapy, and environmental modifications for synergistic effects. By actively engaging the parasympathetic system, modulating neurochemical pathways, and directing attention away from nociceptive amplification, controlled breathing techniques provide a robust, evidence-based approach to reducing pain intensity, enhancing resilience, and improving overall nervous system regulation. Regular practice establishes both immediate and long-term benefits, empowering individuals to regain control over their experience of pain and maintain functional capacity in daily life. Attention and mindfulness training are powerful tools for reducing and managing pain because pain perception is not purely a sensory phenomenon. It is profoundly influenced by cognitive and emotional processes. The brain evaluates nociceptive input through multiple circuits, including the anterior cingulate cortex, insula, prefrontal cortex, and limbic structures such as the amygdala. Pain intensity and suffering are amplified when attention is hyper-focused on the sensation or when anticipation, anxiety, and stress occupy cognitive resources. Mindfulness-based practices retrain the brain to observe pain non-judgmentally, reducing affective amplification and improving the ability to tolerate discomfort. This approach works by strengthening top-down inhibitory control from the prefrontal cortex over hyperactive pain processing regions, recalibrating the nervous system's response to nociceptive signals. Mindfulness meditation involves focused attention on the present moment, often using the breath, body sensations, or ambient awareness as anchors. During practice, the brain learns to differentiate between the raw sensory input of pain and the emotional and evaluative reactions that typically exacerbate it. Neuroimaging studies show that consistent mindfulness practice reduces activity in the anterior cingulate cortex and insula, areas responsible for the emotional salience and intensity of pain, while increasing connectivity between the prefrontal cortex and limbic regions. This enhanced prefrontal control allows individuals to experience pain with reduced emotional reactivity and decreased subjective suffering, even if the nociceptive signal remains unchanged. Body scanning is a specific form of mindfulness that directs attention systematically through different regions of the body. This technique trains the brain to notice sensations without judgment or reaction, fostering awareness of subtle differences between tension, discomfort, and actual nociceptive input. By cultivating a metacognitive perspective, body scanning reduces catastrophic thinking and anxiety related to pain, which are known to amplify both chronic and acute pain experiences. It also engages interoceptive networks that improve the brain's ability to filter irrelevant pain signals, increasing the threshold for discomfort. Focused awareness and mindful movement practices, such as yoga or Tai Chi, integrate attention training with physical activity. These approaches combine gentle movement with breath awareness and sustained attention, which not only improve musculoskeletal function, but also reduce the amplification of pain through attentional redirection. Engaging the body in controlled movement while maintaining mindful focus supports neuroplasticity in pain circuits, enhancing inhibitory control, and strengthening endogenous analgesic pathways, including endogenous opioid and endocannabinoid systems. Mindfulness also interacts with stress and emotional regulation systems that influence pain perception. Chronic pain often triggers heightened sympathetic activation and increased cortisol release, which amplify nociceptive signaling and contribute to inflammation. Mindfulness training reduces sympathetic overactivity, lowers cortisol levels, and promotes parasympathetic engagement, indirectly modulating spinal nociceptive pathways. By combining attentional control with autonomic regulation, mindfulness provides a dual mechanism for reducing both the intensity and emotional impact of pain. Additionally, mindfulness training supports long-term resilience and functional recovery. By regularly practicing non-judgmental awareness, individuals strengthen prefrontal limbic circuits responsible for adaptive coping, allowing them to maintain daily activities, cognitive performance, and emotional stability despite ongoing discomfort. Mindfulness can be used alone or in combination with other interventions such as controlled breathing, environmental optimization, physical activity, and pharmacological support, creating a comprehensive framework for pain management that addresses both the sensory and emotional components of suffering. Attention and mindfulness training demonstrate that perception and cognition play a central role in pain modulation. By cultivating present moment awareness, reducing emotional amplification, and enhancing top-down inhibitory control, these practices allow the nervous system to recalibrate, increase pain tolerance, and improve overall quality of life, providing a sustainable and evidence-based strategy for managing both acute and chronic pain. Physical activity and movement are critical tools for reducing and managing pain because they influence both peripheral and central mechanisms that regulate nociception and neuroplasticity. Pain is often exacerbated by sedentary behavior, muscular weakness, joint stiffness, and maladaptive movement patterns, all of which increase nociceptor activation and reinforce chronic pain circuits. Engaging in regular, moderate-intensity exercise, stretching, or mobility training improves tissue perfusion, reduces inflammation, enhances joint and muscular function, and stimulates neurochemical systems that elevate pain thresholds. Movement also interacts with the central nervous system, modulating endogenous analgesic pathways, including endorphins, endocannabinoids, and serotonergic signaling, which provide natural pain inhibition and mood enhancement. Aerobic exercise, such as walking, cycling, or swimming, increases blood flow to muscles and joints, enhancing oxygen delivery and nutrient transport, which accelerates tissue repair and reduces localized inflammatory processes that activate nociceptors. Exercise also promotes the release of brain-derived neurotrophic factor, BDNF, which supports synaptic plasticity in neural circuits, responsible for sensory integration, emotional regulation, and cognitive control. By enhancing neuroplasticity, physical activity allows the nervous system to recalibrate pain pathways, improving the ability to inhibit exaggerated nociceptive signals and strengthening prefrontal modulation over limbic and spinal circuits involved in pain perception. Resistance training and strength exercises improve musculoskeletal resilience, which reduces mechanical stress on joints and soft tissues. Weak or imbalanced muscles contribute to compensatory movement patterns that increase nociceptive signaling and perpetuate chronic pain cycles. By targeting these weaknesses, resistance training reduces the frequency and intensity of mechanical nociceptive input, protecting joints and ligaments while improving postural stability. Consistent strength training also stimulates endogenous opioid release, which elevates pain thresholds and provides immediate analgesic effects during and after exercise. Flexibility and mobility practices such as yoga, Pilates, or dynamic stretching reduce tissue stiffness and improve range of motion, limiting sustained nociceptor activation that can arise from prolonged tension or postural strain. These movements are particularly effective when combined with controlled breathing and mindful awareness, which further enhance parasympathetic engagement, reduce sympathetic overactivation, and lower the emotional amplification of pain. Mindful movement engages interoceptive awareness, allowing individuals to detect subtle tension patterns and release muscular areas that contribute to chronic discomfort. Exercise also interacts with systemic neurochemical and hormonal systems that influence pain perception. Physical activity stimulates endocannabinoid signaling, which acts on cannabinoid receptors in the central and peripheral nervous system to dampen nociceptive transmission. Serotonin and dopamine release are enhanced during exercise, improving mood and increasing the ability to tolerate discomfort. Cortisol levels are modulated, preventing stress-mediated amplification of pain signals, and heart rate variability increases, reflecting enhanced parasympathetic control over nociceptive pathways. Importantly, physical activity should be tailored to individual capacity and pain thresholds to prevent overexertion or injury. Gradual progression, low-impact exercises, and consistent routines maximize analgesic effects while minimizing the risk of exacerbating pain. Integration with other interventions such as controlled breathing, mindfulness, and sleep optimization creates a synergistic framework that enhances neuroplasticity, reduces inflammation, and strengthens endogenous pain-modulating systems. Movement and exercise are therefore foundational tools for pain management because they simultaneously improve peripheral tissue health, recalibrate central pain circuits, and enhance neurochemical and hormonal systems that regulate nociception. By combining aerobic, strength, and mobility-focused activities, individuals can reduce pain intensity, increase tolerance, and restore functional capacity. Creating long-term resilience in both the musculoskeletal environmental optimization is a crucial strategy for reducing and managing pain because the nervous system is highly sensitive to external cues, including light, temperature, and ergonomics. Pain perception is not solely determined by nociceptive input. It is amplified or dampened depending on contextual and environmental factors. Exposure to natural light, ambient temperature modulation, and proper body positioning can all influence the brain's processing of pain signals, autonomic nervous system activity, and inflammatory responses. By strategically shaping the environment, individuals can create conditions that reduce nociceptive amplification, improve comfort, and enhance both physical and psychological resilience. Light exposure plays a critical role in pain modulation by influencing circadian rhythms, mood, and neurochemical signaling. Morning sunlight increases cortisol and dopamine levels, promoting alertness, attentional focus, and emotional stability, which reduces the subjective amplification of pain. Natural environments also enhance parasympathetic tone, lowering heart rate and stress-induced sympathetic activation that can exacerbate nociceptive signaling. In contrast, dim, poorly lit, or chaotic environments may elevate stress, increase anxiety, and heighten the brain's sensitivity to pain signals. Light exposure interventions, such as strategically timed bright light during the day and minimizing artificial blue light at night, support circadian entrainment, and help maintain optimal pain thresholds. Temperature modulation is another key environmental tool. Heat application, such as warm compresses or heating pads, relaxes muscles, improves blood flow, and reduces stiffness, which can diminish nociceptor activation and alleviate musculoskeletal pain. Cold therapy, including ice packs or contrast baths, reduces inflammation, slows nerve conduction, and temporarily inhibits nociceptive signaling, providing analgesic effects. Temperature-based interventions interact with spinal gating mechanisms, modulating the transmission of pain signals to the brain. Alternating heat and cold therapies can also stimulate circulation, reduce edema, and enhance recovery in both acute and chronic pain conditions. Ergonomics and posture significantly impact mechanical stress on joints, muscles, and connective tissues. Improper seating, repetitive strain, or prolonged static positions can lead to sustained nociceptive input and central sensitization, increasing chronic pain. Adjusting the workspace using supportive chairs, optimizing monitor height, and maintaining neutral spine alignment reduce unnecessary stress and prevent pain escalation. Similarly, proper lifting techniques, footwear, and sleep positions reduce biomechanical strain and support tissue resilience. By minimizing environmental contributors to mechanical stress, individuals decrease persistent nociceptive signaling and improve overall comfort. Sound, clutter, and sensory load also influence pain perception. Environments that are quiet, organized, and low in distracting stimuli reduce sympathetic arousal, allowing the nervous system to focus on restorative processes rather than amplifying nociceptive input. Incorporating elements such as soft lighting, calming colors, and natural surroundings can modulate limbic and prefrontal circuits involved in emotional evaluation of pain, reducing perceived intensity and enhancing coping. Environmental optimization is most effective when combined with other interventions, such as controlled breathing, mindfulness, physical activity, and sleep hygiene. Strategic manipulation of light, temperature, posture, and sensory stimuli amplifies the body's endogenous pain inhibitory systems, reduces stress-mediated amplification, and improves overall functional capacity. By consciously shaping the environment to support circadian rhythms, reduce mechanical stress, and enhance comfort, individuals can influence both the perception and intensity of pain. Environmental factors act as powerful modulators of nociceptive and central processing, demonstrating that context and surroundings are integral to effective pain management and nervous system regulation. Sleep quality and restoration are fundamental tools for reducing and managing pain because sleep exerts profound effects on both peripheral and central pain processing systems. Pain and sleep are bidirectionally linked. Insufficient or fragmented sleep amplifies nociceptive signaling, increases central sensitization, elevates inflammatory markers, and lowers pain thresholds, while high-quality sleep dampens pain perception, enhances recovery, and supports neurochemical balance. Slow-wave sleep and REM sleep, in particular, are essential for recalibrating neural circuits, consolidating memory, regulating mood, and facilitating restorative processes in musculoskeletal and nervous systems. Poor sleep leads to hyperexcitability in spinal and supraspinal nociceptive pathways, increases sympathetic activity, and diminishes endogenous pain inhibitory mechanisms, highlighting the critical role of restorative sleep in pain management. During sleep, the body engages in multiple processes that reduce pain and restore function. Slow-wave sleep facilitates glymphatic clearance of metabolic waste from the brain, including inflammatory cytokines and neurotoxic proteins that can exacerbate pain perception. REM sleep supports emotional processing and regulation of limbic and prefrontal networks, which modulate the affective component of pain. Sleep also stabilizes hormone rhythms, including cortisol, growth hormone, and melatonin, all of which influence nociceptive signaling, tissue repair, and immune function. Disruption of these rhythms through inadequate sleep or misaligned sleep timing amplifies pain sensitivity, reduces recovery capacity, and impairs cognitive and emotional resilience. Sleep deprivation or fragmentation triggers neurochemical changes that exacerbate pain perception. Reduced serotonin and dopamine availability impair descending inhibitory pathways that normally suppress nociceptive transmission in the spinal cord. GABAergic tone is diminished, decreasing inhibitory control over hyperactive neurons in pain processing regions such as the anterior cingulate cortex and insula. Elevated sympathetic activity and cortisol levels increase peripheral inflammation and heighten nociceptor excitability, further intensifying the subjective experience of pain. Chronic sleep disruption creates a vicious cycle in which pain interferes with sleep, and poor sleep amplifies pain, perpetuating chronic discomfort and impairing quality of life. Behavioral strategies to improve sleep quality are therefore critical for effective pain management. Maintaining consistent sleep and wake times, limiting exposure to artificial light in the evening, and creating a dark, quiet, and comfortable sleep environment supports circadian alignment and melatonin production. Avoiding stimulants, such as caffeine or high-intensity exercise close to bedtime, reduces sympathetic arousal, allowing the nervous system to transition into restorative states. Relaxation techniques, including controlled breathing and mindfulness, enhance parasympathetic activation, promote deeper slow-wave sleep, and reduce nocturnal hypervigilance to pain. Sleep hygiene interventions can also complement other pain management strategies. When combined with controlled breathing, mindfulness, movement, and environmental optimization, high-quality sleep amplifies endogenous analgesic systems, reduces inflammation, and enhances neuroplasticity in circuits responsible for pain modulation. Over time, consistent restorative sleep strengthens the nervous system's capacity to inhibit nociceptive signals, improves tolerance to chronic pain, and supports functional recovery in musculoskeletal and neural tissues. By prioritizing sleep quality and restoration, individuals directly influence both the sensory and emotional dimensions of pain. High-quality sleep recalibrates nociceptive networks, stabilizes neurochemical and hormonal systems, reduces central sensitization, and enhances cognitive and emotional resilience. Ensuring adequate restorative sleep is therefore a foundational pillar for effective pain management, empowering the nervous system to regulate, inhibit, and recover from acute and chronic pain experiences. Neurochemical and pharmacological support is a critical tool for reducing and managing pain, because pain perception is heavily influenced by chemical signaling in the nervous system. Endogenous systems, including opioids, endocannabinoids, serotonin, and dopamine, play central roles in modulating nociceptive input and regulating the emotional and cognitive aspects of pain. By enhancing or supporting these neurochemical pathways through behavioral, nutritional, or pharmacological means, the nervous system's ability to inhibit pain is strengthened, improving tolerance, reducing suffering, and facilitating functional recovery. Pharmacological interventions, when used appropriately, provide additional targeted modulation of nociceptive transmission and inflammatory processes, complementing natural pain regulatory mechanisms. Endogenous opioids are among the most potent natural pain modulators. These neuropeptides, including endorphins, enkephalins, and dynorphins, bind to opioid receptors in the spinal cord, brainstem, and limbic system to inhibit nociceptive transmission and reduce the effective dimension of pain. Activities such as aerobic exercise, resistance training, mindfulness meditation, and controlled breathing stimulate the release of endogenous opioids, providing both acute analgesia and long-term enhancement of pain inhibitory circuits. Activation of opioid pathways also interacts with dopaminergic reward circuits, which improves mood, motivation, and emotional resilience, indirectly reducing the amplification of pain signals caused by stress or anxiety. Endocannabinoids, naturally produced lipid-based neurotransmitters, regulate nociceptive signaling through CB1 and CB2 receptors in the central and peripheral nervous system. Endocannabinoids inhibit excitatory neurotransmission at spinal synapses, decrease neuroinflammation, and modulate synaptic plasticity in pain circuits. Behavioral interventions such as exercise, exposure to sunlight, and controlled stress can enhance endogenous endocannabinoid activity, providing analgesic effects without the side effects associated with exogenous cannabinoids. Endocannabinoid signaling also contributes to mood regulation and cognitive flexibility, mitigating the emotional amplification of pain. Serotonin and dopamine are key neuromodulators that influence descending inhibitory pathways, prefrontal limbic connectivity, and attention to pain. Adequate serotonin levels improve spinal inhibition of nociceptive transmission, regulate mood, and support sleep, which in turn enhances pain tolerance. Dopamine enhances reward, motivation, and attentional control, allowing the nervous system to shift focus away from pain perception and improve functional engagement despite discomfort. Behavioral strategies such as exercise, light exposure, mindfulness, and structured social engagement naturally optimize serotonergic and dopaminergic activity. Pharmacological interventions can supplement endogenous systems when pain is severe or persistent. Analgesics, anti-inflammatories, and neuromodulatory agents target nociceptive transmission, inflammation, or receptor activity to reduce pain intensity and support functional recovery. These interventions are most effective when combined with behavioral and environmental strategies, as they complement natural inhibitory circuits rather than replacing them. Timing, dosage, and type of pharmacological support should be carefully tailored to minimize side effects and avoid dependency while enhancing overall neurochemical regulation. Integration of neurochemical support with lifestyle interventions maximizes pain modulation. Exercise, controlled breathing, mindfulness, sleep hygiene, and environmental optimization all enhance endogenous opioid, endocannabinoid, serotonin, and dopamine pathways. Pharmacological support can then be applied strategically to reduce acute nociceptive transmission, manage inflammation, or facilitate neurochemical balance during periods of heightened pain or treatment. By leveraging endogenous neurochemical systems and, when necessary, pharmacological interventions, the nervous system's capacity to inhibit pain, regulate emotional responses, and maintain functional performance is strengthened. Neurochemical and pharmacological support provides both immediate relief and long-term modulation of pain circuits, creating a comprehensive framework that empowers individuals to manage acute and chronic pain effectively while enhancing cognitive, emotional, and systemic resilience. By strategically supporting neurochemical pathways and, when appropriate, integrating pharmacological interventions, individuals can optimize the nervous system's natural ability to regulate pain, reduce suffering, and maintain functional capacity. Enhancing endogenous opioids, endocannabinoids, serotonin, and dopamine through behavioral strategies such as exercise, mindfulness, sleep optimization, and environmental alignment amplifies the body's innate analgesic mechanisms. When combined with carefully tailored pharmacological support, these interventions create a comprehensive multidimensional framework for pain management. This approach not only reduces pain intensity, but also strengthens emotional resilience, cognitive function, and overall quality of life, empowering individuals to regain control over their experience of discomfort and maintain long-term physical and neurological health.